April has long been observed as Parkinson's Awareness Month. In fact, it is the birth month of James Parkinson, the London physician who was the first to describe Parkinson's disease in 1817.
Currently, more than 1 million Americans live with the progressive brain disorder. Some well-known names, both past and present, with Parkinson's include Janet Reno, Muhammad Ali, and Michael J. Fox.
While treatment can help those with Parkinson's, better understanding of the disease also gets results. Morning anchor and health reporter Kirsten O'Connor has those questions in today's Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, hand tremors or facial expression, rigid movement, those are a few common symptoms patients with Parkinson's disease may experience. And we recently spoke with Dr. Nestor Galvez, a neurologist at Cleveland Clinic in Florida. And he says there are early onset patients, plus those who develop Parkinson's disease later on in life.
The issue here is that because it is a complex disorder and we do not know really what causes it, we could argue that all members of this family were exposed at one point to the same environmental, in quotes, toxin, so to speak, or situation that make them later on develop Parkinson's. The other issue that we have to keep in mind that say that there may be some genetic background. Well, one issue is to have the genetic susceptibility, and the other one is to have the genes that will make you develop the Parkinson's no matter what. Currently, we believe that Parkinson's disease occurs as a consequence of something that we don't understand yet that causes this cascade of events that someone will develop this degenerative condition. However, as knowledge has been accrued, now we do understand that there are a proportion of them that will have a genetic background.
Well, just like Parkinson's, Alzheimer's disease is also a neurodegenerative condition, and both conditions are results of an aging brain. Dr. Galvez says they can coexist, but one disease does not lead to another.
Now, some individuals, like anything in medicine, may have a combination of factors, may have a combination of pathology that when you look at the understanding, the biology, some individuals are hit with what we call a double whammy. They may have Parkinsonian pathology, but they also develop Alzheimer's type pathology. So they may have the Parkinson's disease dementia complex. Some of them may have a very aggressive form of Parkinson's disease, which leads to some form of dementia, or the other way around. Some people who have Alzheimer's disease suddenly develop symptoms related to Parkinsonism. 10% of Alzheimer's patients will develop symptoms related to Parkinson, but not the true Parkinson, but
And when it comes to treating Parkinson's disease, Dr. Galvez says patients should consider many factors before deciding which way to go.
The age of the person, is it young, is it older? Is the person working or is retired? What are the goals? You have to have the person be part of that decision-making process. What is it that you would like to accomplish? What is it that symptoms are bothering you the most? So you can have a better understanding of what the goals are, so you can tailor the treatment depending on what the patient wants or needs are. We have medications that can work directly on the dopamine receptors. We have medications such as levodopa, which is a very common one that people hear, that provides the raw material, so to speak, so the brain can produce dopamine, and that's how we can treat them. And there's other new drugs that can work in different receptors and different enzymes to enhance either the direction of the levodopa or can enhance the after effects or prevent some complications.
Physical, speech, and occupational therapies are also very important, and Dr. Galvez advises patients to be active. Though there's no known root cause of Parkinson's disease, Galvez says maintaining good nutrition and a healthy diet is a good step in maintaining brain health.